So what is MAT?
It's medication-assisted treatment. It's a group of medications that are specifically used for substance abuse disorders. And most often when we're talking about substance abuse disorder, it's opiate use disorder.
When an individual with an opiate or other drug addiction enters the legal system, connecting them with treatment is essential to helping them reach stability and avoid recidivism or reoffending. One method that is gaining traction in the U.S. is medication-assisted treatment. In Jackson County, we have the evidence that backs up what the rest of the country and world is seeing with this specific type of program.
So what is MAT?
It's medication-assisted treatment. It's a group of medications that are specifically used for substance abuse disorders. And most often when we're talking about substance abuse disorder, it's opiate use disorder.
Is there any evidence that says this program works?
Absolutely. There's a lot of evidence that this program works. Overall, these medications provide clients with the best opportunity to be successful in multiple areas in their life. They have better health outcomes. They're less likely to use the emergency room. They're less likely to have significant long-term illnesses that need to be treated. They also have better outcomes in employment and education. They get employed and stay employed. In addition, they use less community resources, child welfare, some of the other welfare programs. In addition, from a supervision standpoint, they spend more time in treatment when they're on these drugs. They have less days of illicit drug use. They also they miss less days. It even includes if just we refer them to a doctor who can prescribe these, and we still see the evidence in the world still shows that there is those reductions in illicit drug use and increase in treatment adherence, even if they don't actually ever get engaged with medication-assisted treatment.
How has community justice's approach to drug use changed over the years?
When I first started, it was incredibly punitive. How we handled drug use was we tried the deterrence theory that frequent UAs, frequent consequences, and sometimes severe consequences, significant amount of days. How that's changed is we look at drug use as a treatment issue. Instead of a criminal issue, we look at how we can help clients get tied into medication-assisted treatment, get tied into traditional treatment, counseling, help them skill build. However, we still have that safety component, so I don't want that to get lost in here. When clients are using drugs and committing offenses or creating problems in the community, we still respond appropriately with in-custody sanctions and those things. But when those things are absent, and we're talking about just self-harm, we look at it as a treatment issue and something that we can work on and have them be successful.
Has MAT been successful in Jackson County?
We actually have tracked quite a bit of stats. So a group of clients who started medication-assisted treatment between February 2008 and November of 2019, we have tracked them. What we saw is 76% of this group didn't reoffend, which when you compare that to the state in general, that's a flip. Because these are high-risk offenders. These are those most likely to reoffend. And what also is we had a 60% reduction in the use of custody as whether that be new crimes, arrest for probation violations, and that's for the group at whole. If we take it the group that is still receiving services right now, and they've almost been in a full year, the average, 515 days they used the year days in custody the year before starting medication-assisted treatment, and then from starting medication-assisted treatment until almost a full year, they've used 15 days. So we're talking a 96% reduction in the use of jail beds. That correlates to a significant amount of savings, clients not having to start over, their ties to the community and especially not having to start medication over.